Yeah, thanks, Dr. Blumberg. And so, one thing we emphasize is just the key, the need to get rapid diagnosis, so to get treatment started as soon as possible. So I'll turn to Dr. Cubb, and how would you summarize if you had a patient in front of you that you were concerned of having anaplastic thyroid cancer? What are the steps you would take to make sure that they are getting to treatment as quickly as possible?
Yeah, so one thing I want to make sure of, I know we've talked a lot about doom and gloom and this and that and high mortality, but truly we see this in an area where we're, really able to help patients. I think first off, I would make sure you're at a center that's familiar with this, right? I think there can sometimes be a tendency to always go to surgery, etc. And what you want are people that are really familiar with this disease process. So I highly recommend being at a center where you have multiple disciplines that are familiar with this. We're really lucky, as you can see, we have a pathologist, endocrine oncologist, medical oncologist, surgeon, everyone that's really, in tune with the disease. So I would say number one, making sure you're at a center where that expertise is there. Two, establishing the diagnosis of anaplastic thyroid cancer. Again, this is one thing that I've seen frustration on a patient's part is that with the biopsy, it can take a little bit of time. So if there is delay, et cetera, again, making sure you're at a center that has familiarity with the disease process is very important. Getting that assessment of what is driving this tumor. That is so important so we can figure out what is the right treatment for you, whether it's radiation, external beam radiation up front, whether it's chemotherapy, whether it's going directly to surgery. Knowing what is driving the mutation really helps us be able to do that. So that we have the biopsy as well as have some idea of what's going on if we can get it through looking at tumor sample in the blood. Then also getting that staging evaluation done. Being at a center that has familiarity with this, we try to get that done as soon as possible in our patients. We talked about a lot of different scans, but basically it's looking at you from head to toe, from everything from a brain MRI to a PET scan. Sometimes there can be some CT scans and MRIs of other parts mixed in there as well. But overall, the first step is one, determine if after we know all this information, is should we go to surgery? Should we not go to surgery? Again, there's lots of nitty gritty little details that go into that. So we're not going to go into the specifics here. But it is a longer conversation in terms of to figure that out. Should we be considering external beam radiation? And then also looking for the possibilities of clinical trials, especially in our patients that do not have a BRAF mutation.